Strange magic indeed. These next few pieces are exposés and deeper look into some of the other skullduggery that's going on to do with COVID also. And the first one is Merck, and it's shutting down development of its coronavirus vaccines after clinical research produced disappointing results, according to them on Monday. And early-stage studies found that Merck's 2 experimental shots produced immune responses that were inferior to those generated by other COVID-19 vaccines. Now, the vaccine candidates also provoked immune responses weaker than those seen after someone is naturally infected with the virus, even though those shots were generally well tolerated. After someone is naturally infected, does that mean in some cases they were artificially infected? Oh my. Perhaps an up-and-coming blockbuster show will reveal more on that. Now, Merck said it will now focus its anti-pandemic efforts on researching and producing 2 COVID treatments that it has in the pipeline. And the New Jersey-based pharma giant reached a $356 million deal to supply the US government with one of those drugs, known as MK-7110. which has been shown to reduce hospitalized coronavirus patients' risk of death or respiratory failure by more than 50%. An MK drug now? All very MK Ultra that to me, given Merck were involved in human experimentation before and during World War I and II, and also given their proximity to Montauk. Now, Merck is currently conducting clinical trials for an antiviral drug known as Molnupiravir, which is being developed in collaboration with Ridgeback Bio. Ridgeback Bio are currently under investigation for misleading evidence of their vaccines and drugs and attempting to attain $100 million funding from BARDA. I think we covered BARDA in Exposé 1 or 2. Now, the lead people of Ridgeback Bio are both former hedge fund managers, which shows again of advanced knowledge and money-making opportunities to be made by those on the inside of this scam. Now, those studies are expected to wrap up in May, and data on the drug's effectiveness should be available in the first quarter of this year, they said. Now, Merck was working on a one-dose coronavirus vaccine like the one developed by Johnson & Johnson, which is expected to ask the feds to clear its shop for emergency use in the coming weeks. Really? Johnson & Johnson produced one with only a 66% safety rating. Now, one of Merck's vaccines used a so-called virus to deliver the coronavirus spike protein to the body and provoke an immune response. Now, the one they used was vesicular stomatitis virus that can only infect insects, cattle, horses, and pigs. Common sense question again. What have those animals got to do with humans? And if they are using that virus to boost the immune system, the great question is, why don't they use the coronavirus to boost the immune system? Oh, I forgot they don't have any. The company that used the same technology in its Ebola vaccine, which was the first of its kind and approved for use in humans. Now, Merck's other vaccine candidate used a measles virus as a Trojan horse to trigger an immune response to COVID-19. Your life in their hands, really. Not for me, it's not. Here's another expose. The global vaccination project against the COVID-19 pandemic of the World Horror Organization called CoVax has ended up in the hands of Bill Gates, who is also the leading investor in 4 of the major multinational pharmaceutical manufacturers of the vaccines. So now he's in control of the World Horror Organization and the 4 leading pharmaceutical companies, which is BioNTech, GlaxoSmith, which also controls 68% of Pfizer and their commercial branches in Italy and other parts of the world, and also Mode RNA company. Now, in practice, the self-styled maniac of vials and syringes is raising millions of dollars from nations and foundations around the planet to allow them to buy antidotes that are sold by the big pharma cartel at a controlled price. And for a project of global immunization that, to all intents and purposes, details a very certain and profitable business for the shareholders, the same speculative investment funds of the lobby of weapons, I might add, all whilst it is not known what genetic or pathological effects it could have on the world population. Now, the conflict of interest is so macroscopic and shameless that the Sputnik International Network, which is funded by the Moscow government and obviously more interested in cheering on the Russian Sputnik 5 vaccine, which has already been purchased by 23 nations, called the CoVax system a syndicate. That also showed the sensational connections not only with Gates, but also with the bulk of the multinationals he controls. Now, the CoVax CEO is Aurelia Nguyen, who is likely a descendant of the Vietnamese noble lineage, who has also undertaken research for the World Horror Organization on genetic drug policies. So we took a look into her. She's a certified accountant and has a master's in health policy, planning and funding from the London School of Hygiene and Tropical Medicine and the London School of Economics. And from 2011 to 2020, before the establishment of CoVax under the auspices of WHO, World Horror Organization, she also worked as a manager for Gavi Alliance, which is an NGO founded in 1999 with $750 million funded by the Bill and Melinda Gates Foundation, which so far has invested about $4 billion for the global immunization projects carried out, thanks to the vaccines sold by the companies controlled by Gates in a plethora of conflicts of interest. But before joining Gavi in 2011, Aurelia Nguyen held a number of positions within GlaxoSmithKline also, where she led the development of GSK's policies on access to drugs and vaccines in the developing world. Now, GSK, GlaxoSmithKline, which will increase its revenues thanks to the Comirnaty messenger mRNA vaccine, which is produced by Pfizer, which is a subsidiary of GlaxoSmithKline, with BioNTech, and that German company was also financed by Gates with $55 million. Oops. Now, the company that has seen its earnings grow massively in Italy. Why? Well, that's all thanks to a pilot project of 12 compulsory vaccines in schools, which was promoted by the global health security agenda created by the former President Barack Obama, of which Gates was the main political donor, as Pfizer instead supported the candidacy of Joe Biden. Oh my. And despite these shady business intrigues, the World Health Organization funded nearly €1 billion from the Gates Foundation, which sponsored the appointment of the Ethiopian Tedros Adhanom Ghebreyesus as Director General. That has allowed the global vaccination project to be carried out. So from the Gavi Alliance, together with the CEPI, Coalition for Epidemic Preparedness Innovations, which is another NGO founded by Gates and was presented in Davos in 2017. In case you can't see it by now, this is a total money exercise. And also a chance to do public research on a mass scale. Some people will make it. Some people will suffer mildly. Some people will suffer badly. And some people will die. But the bottom line is to these people is they don't care, as they're all on kickbacks and will increase their bank balances. And I think this is an example of one person on a call I had recently with, where it stated we need free enterprise. Free enterprise does not involve governments, and neither does this. Free enterprise allows people with bargaining power to gain unfair advantage, with governments now in the pockets of these big cartel ring of companies. Its new boss, same as the old boss, with even more stringent measures working against the people. And this is on a par and no different to what happened 100 years ago with the energy companies' drain and control of all the markets. And you know what happened at the end of that decade, don't you? And we need people to start being considerate of others. Need, not greed, for this type of harvesting practice to end. But according to that individual, need, not greed, caring and sharing, cooperative, not comparative or competitive, is a flawed model. Nope. It is a new, basic, common sense model. It is the people who are flawed. But given Gates is at the centre of all of it, at which point will the people turn en masse against Gates? The man's a homicidal maniac. He's told you all he wants to kill most of us. And he still walks amongst us. The whole world is being taken over by vulture capitalists in a free enterprise system, and one group thinks that is the way forward. And that says much about the lack of knowledge and research applied, and another example of the flawed model of liberalism, which is where free enterprise comes from. This is not so much an expose as a warning, and a lot of people should take note of this. And it comes from a common law group and fairly detailed research. And the start of it says, are states and governments and private employers about to mandate COVID-19 vaccines? There are many opaque current and future legal issues around COVID-19 and the measures to contain it. Fortunately, because the Pfizer and Mode RNA vaccines are emergency use products and as such not fully licensed, the law is clear. States may not mandate the vaccines and private entities do so at the peril of violating federal law. And that law governs vaccines approved for emergency use. So for the time being, there are only 2 COVID-19 vaccines available in the United States, the Pfizer-BioNTech vaccine and the Mode RNA vaccine. And the US Food and Drug Administration had issued them both emergency use authorizations, EAU, but not yet full vaccine licenses. Now, the New York State Assemblywoman Linda Rosenthal recently proposed a bill to mandate COVID-19 vaccines, but she apparently neglected to consult federal law on emergency use authorization. Linda Rosenthal, born in and born to. Just saying. Now, emergency use authorization means that any product with this designation must be voluntary. And under 21 U.S.C. 360 BBB-3, authorization for medical products for use in emergencies, and it states appropriate conditions designed to ensure that individuals to whom the product is administered are informed. 1. That the Secretary of Health and Human Services has authorized the emergency use of the product. 2. Of the significant known and potential benefits and risks of such use, and of the extent to which such benefits and risks are unknown. And 3. Of the option to accept or refuse administration of the product, of the consequences, if any, of refusing administration of the product, and of the alternatives to the product that are available, and of their benefits and risks. They're the details that has to be provided under an EAU, which is the 2 current vaccines. Now, under federal preemption doctrine, this federal EAU law trumps state law, meaning that states and municipalities may not mandate EUA products. As the FDA states, the FDA believes that the terms and conditions of an EUA issued under Section 564 preempt state or local law. That was from the FDA. Both legislative requirements and common law duties that impose different or additional requirements on the medical product for which the EUA was issued in the context of the emergency declared under the Section 564. Now, in an emergency, it is critical that the conditions that are part of the EUA or an order or waiver issued pursuant to Section 564A, those that FDA has determined to be necessary or appropriate to protect the public health, be strictly followed, and that no additional conditions must be imposed. And this was also confirmed in August 2020 at the CDC when they published the meeting of the Advisory Committee on Immunization Practices, where its Executive Secretary, Dr. Amanda Cohen, stated, "I just wanted to add that to remind everybody that under an emergency use authorization, an EUA, vaccines are not allowed to be mandatory." Amanda Cohen, born to. Top of the advisory committee for the CDC. Now, some people will say that is racist to keep pointing it out. But after the Rosenthal interview, and I have another one coming up that's even worse, in From Russia with Love +4 and 5, we are right to have concerns of why they are in the top or every top position deciding on public policy in every country, it seems, that never seems to benefit public policy. Remember, they told you anti-Semitism was a meme and guilt-based theme deliberately brought in to stifle people questioning their motives. So early in this vaccination phase, individuals will have to be consented and they won't be able to be mandated. Governors may not mandate EUA vaccines or EUA tests for COVID infection. States cannot override federal law or set up their own mandatory scheme. And they cited an example, Lorry Lard Tobacco versus Riley, which overturned a state public health law because it was already the subject of a comprehensive federal scheme to manage public health, and also the Department of the Navy versus Egan. And they said, for more information on state and local law, see the Emergency Use Authorization Toolkit from the Association of State and Territorial Health Officials. So what about private employers? Can they do it? A private party such as an employer, school or hospital cannot circumvent the EUA law. For example, the fact sheet approved last month by the FDA for the Pfizer vaccine states it is your choice to receive or not receive the Pfizer-BioNTech COVID-19 vaccine. Should you decide not to receive it, it will not change your standard medical care. The previously referenced section of the FDA and Cosmetic Act governing medical products for approved emergency states that the FDA-approved fact sheet must state the consequences, if any, of refusing administration of the product. And nowhere in the fact sheet of the FDA does it specify that a person may be fired from their employment, denied education, disciplined, or otherwise discriminated against for refusing the vaccine. With that said, the law on private entities are likely to be litigated. Even the most ardent advocates of the COVID-19 vaccines acknowledge that employer mandates would be problematic and would likely lead to litigation. Now, one of the initial issues in litigation would be that EUA law applies to a person who carries out any activity for which the authorization is issued. And while this phrase plainly refers to healthcare workers, for example, those who vaccinate the public, it can also refer to anyone who participates in the EUA activity, such as employers requiring the product. Now, the FDA even applies the term to those who advertise the product as well. So courts are likely to find that EUA law covers employers carrying out their own vaccination requirements, as well as states and also municipalities. But what if a private employer stubbornly refuses to heed the EUA law and attempts to require its employees to get EUA vaccines anyway? Under the law, employees are likely to lose if challenged in court for the above stated reasons, and also because the FDA did not issue an emergency dispensing order to even attempt to circumvent EUA requirements. Indeed, the EUA law preventing mandates is so explicit that we found only one precedent case regarding an attempt to mandate an EUA vaccine, and the court held that the vaccine could not be mandated even to people in the military. So there's never been a case that's gone through court where mandatory has been approved. In Doe versus Rumsfeld, yes, that clown, in April 2005, in that case, 6 soldiers challenged the US Department of Defense, which at the time mandated EUA anthrax vaccines, which led to those soldiers receiving what has been called Gulf War syndrome. The DoD poisoned their own soldiers. And 6 soldiers sued the DoD to refuse vaccination and actually won. A federal court held that because the anthrax vaccine was an EUA product, the soldiers had the right to accept or refuse the vaccination. And it's a solid precedent showing that because a federal court upheld soldiers' rights to decline the EUA vaccines, it's likely that courts would uphold employees' rights to refuse the EUA vaccines as well. Now, the FDA fact sheet for the Pfizer-BioNTech vaccine states, "It is your choice to receive or not receive the Pfizer-BioNTech vaccine. Should you decide not to receive it, it will not change your standard medical care." In other words, people cannot lose healthcare coverage for refusal. But again, as I say, what happens if the private employer mandates it? Official statements suggest that the employer might lose liability protection against damages from vaccine injury. And according to the Congressional Research Service, private businesses are subject to civil liability unless they acted consistent with applicable directions, guidelines, or recommendations by the Secretary regarding the administration or use of a covered countermeasure, and private businesses may qualify as program planners and thus covered persons when performing certain functions. Now, EUAs for past medical emergencies are instructive, and in 2009, when the Secretary of the US Department of Health and Human Services declared the H1N1 virus emergency, the FDA authorized the emergency use of the drug perimivir. the 4th, and the fact sheet stated that the healthcare provider should communicate to the patient that the Secretary of HHS has authorised the emergency use of the drug, which was not an FDA-approved drug, and the patient had the option to accept or refuse Peramivra, if that's pronounced correctly. Probably not. The Informed Consent Action Network legal team is offering to help individuals challenge employers or schools that are requiring COVID vaccinations. Informed Consent Action Network. Now, that's a good report, which is why it went into the show. I don't believe at this point they will make it mandatory, but they do stealth mandatory practices like you can't fly or go to a public place without the vaccination. And that is still forcing people to have it. And I would like the common law people to go into that more, as that is an actionable activism. If we go to a cashless all crypto society, you will have no option but to receive their poisons. That's where they're heading. But this is a very good piece by a common law group. And despite my efforts to combine them all together as one force, sadly, some of their egos, comparative and competitive mindsets often leaves many of them pissing in the wind. We have to change that.